Also, it is a growing trend, mommy makeovers. Moms getting plastic surgery. What exactly are they getting done, though, huh? You might be surprised on that answer coming up here.
By having some procedures done now. I call them beauty maintenance.
Nothing is worse when there's women, they do those duck lips.
Much and
It's like they think they look beautiful and they look so ugly. Or they do those big cheek things.
Yeah, right, right.
I'd rather like Daffy Duck and like Chipmunk.
A nice glass of champagne for you when we're done.
I like that. A little champagne after the pain.
I believe that a woman should maintain her beauty.
I feel like I'm all gooey.
Stay back, because your hair is going to get this gel off the face.
We all want to look younger, and if you work on it on a timely, regular basis, you'll look younger than what your chronicle age is.
Oh, well, that was a scene from the popular series The Real Housewives of New York City, where many mothers don't have a problem admitting that they get work done. And as it turns out, they are not alone, my friends. The newest trend in plastic surgery is mommy makeovers. They're up a whopping 96% in just the last 6 years, according to the American Society of Plastic Surgery. Joining me now with more is plastic surgeon Dr. Gary Breslow. Hi, doctor.
Hi, Megan. How are you?
I'm well, thanks. All right, so these women were just getting general plastic surgery or procedures,
Yeah.
but the mommy makeover includes something else. Tell us what's in it.
The mommy makeover is a constellation of procedures, essentially a breast augmentation, tummy tuck, breast lift, any combination of that procedure is designed to restore a woman's body. What you showed is, as you said, it's more cosmetic in nature.
And these are before and after.
Right.
What did this person have done in their belly?
This is a tummy tuck procedure, but the concept that people have to understand that this is really more of a restoration procedure. These women come in after pregnancy. I mean, pregnancy really wreaks havoc on several women's bodies.
Is that what we're looking at here? Is this on the left? Is that the aftermath of a pregnant belly?
Right. You're looking at it. You're looking at what happens. What happens with pregnancy is the abdomen distends, over distends, kind of like a rubber band that over distends, and it doesn't come back to its normal shape. And the only way to get it back to its normal shape is with surgery. Sit-ups, these women come into my office, they've basically said they do as many sit-ups as they can and nothing happens. And unfortunately, the only way to fix this is to fix it. But
why is that? Because it's extra skin from well, you know, when your stomach stretches?
Right. There's two things, there's two phenomena that happen. The first is that the abdominal wall, which again is like a rubber band, overstretches. And kind of like a rubber band, it overstretches, it doesn't come back. And then there's also excess skin and stretch marks.
So when you do a tummy tuck, are you actually operating on the abdominal wall?
That's correct. And a tummy tuck is two procedures. It's a tightening of the abdominal wall and a removal of the excess skin. And it's very, very effective at restoring the appearance of the belly. These women, Megan, are not trying to look like supermoms. These women...
Yeah, they want to look like they looked before they had children.
Exactly.
What about the breast augmentation? Because that carries, that's not just one surgery. You got to keep having surgeries with that. Am I wrong?
No, you're not wrong. Breast augmentation is a commitment. It basically it requires a commitment to having surgery every 10 to 15 years or so if you're going to have an augmentation. But some people don't need an augmentation. Some people just require a lift. Pregnancy affects different women differently. Some women, it affects the breast and the abdomen. The breasts in some women are deflated, they're low, they need to be lifted, they need to be fuller again, and the bellies, again, need to be tightened.
What, two other questions. What do you do for stretch marks? A lot of women struggle with those.
Well, the stretch marks, the nice thing about the stretch marks is it's usually in the zone of resection, which means that the stretch marks usually get removed when the excess skin gets removed, and any remaining stretch marks get moved down significantly into a lower position, so they're very well hidden.
And I know they recommend this after you're done having the babies as opposed to in between the babies, but let me ask you before you go, your response to those who say, you know what, this is a self-esteem issue, not a plastic surgery issue. Work on yourself and the way you view yourself. Don't go to a doctor.
This is a self-esteem issue, and what's amazing to me is not only the physical transformation that takes place with these women, but the psychological transformation. These women come into my office very upset with the way they appear, more so in the mirror than anything else. They just want to look and feel better for themselves. And these are the happiest patients anyone has. I mean, the transformation that takes place in terms of restoring their body is truly remarkable.
And I truly have to go, but cost estimate?
Unfortunately, insurance doesn't cover these restoration procedures, but they usually range from about $10,000 to $15,000.
Okay, it's a hefty price tag, but I guess you do a lot. Dr. Gary Breslow, thanks so much for the update.
And does pretty good work too, based on the before and after. Yeah,
that's a lot. That's a lot of nipping and tucking.